The Arkansas Department of Health says the state is seeing the highest levels of whooping cough cases in the last 15 years. 5 News reporter Lauren Spencer joins us now. She spoke with doctors about why cases are rising and what families can do to stay healthy. Lauren.
Yeah, whooping cough, an illness many people may think is rare, is surging in Arkansas and across the country. ADH has been routinely tracking whooping cough for the last 15 years. And so far this year, more than 500 cases have been reported.
All of them in school. I work for a school district, and yeah, we haven't caught anything yet.
This respiratory illness season hasn't quite hit Rachel McIntosh's home.
Got to make sure we stay healthy, get some vitamin D, get outside at least 15 minutes a day. Vitamins.
I even told Ricky yesterday, though, when I took her out.
We do have some precautions that we take.
For families across Arkansas, whooping cough has already had an impact. The Arkansas Department of Health says more than 50 counties have reported at least one case this year.
You start off with just kind of a regular cough, right? And then over the next week or so, it becomes, these really bad coughing fits.
Health officials say the cases have been increasing at both the state and national level. In Arkansas, there were fewer than 40 cases in 2023. In 2024, that number jumped to nearly 400. So why the spike? Doctors say better recognition, waning immunity, and improved reporting all play a role. Infants are some of the most vulnerable.
They have a harder time catching their breaths in between coughs, and it causes them to essentially, pass out. They lose color.
Most cases this year are among school-aged children and teens, where immunity can wear off over time.
Unfortunately, the longer we go between doses of vaccine, the more likely we are to be susceptible to the infection.
And because early symptoms can look like a common cold, doctors say it's important to look for signs and see a physician if necessary.
It's always a good idea if a baby has cough, fever, otherwise being sick, fussy, not taking bottles or not feeding.
This year, at least 50 people in Arkansas have been hospitalized due to whooping cough, and more than 60% of those hospitalized were infants under 1 year old. Doctors recommend staying up to date on your vaccines, washing your hands, and covering coughs and sneezes to prevent the spread. Lauren Spencer, 5 News.